Hello everyone, welcome to Effective Communication session. This session will provide an overview of effective communication, culture vision, health literacy, and language access. We will talk about importance and characteristics of effective communication. We will also share some thoughts in regards to assertive communication and also some of the tools that we will use for effective communication. When it comes to communication, please be mindful about your nonverbal communication such as your body language and also making sure that it's not always what we say, it's how we say it. That's very important of like how we deliver the message to our receiver. Let's discuss how do you communicate. Being assertive is the key. When we be assertive, we are able to express what you think and we feel in a positive way. And also, if we are going to be aggressive, think about the person who is receiving the message. If we are going to be aggressive, it is disrespectful to others. For example, yelling at them or being physical violence. And also, if we are going to be passive, some of us are passive and we walk away from the situation, which is not going to help the situation because we are unable to express our feelings. Failure to communicate effectively. According to Joint Commission, poor communication can lead to medical errors and poor patient outcomes. Let's discuss about the communication tool that we use here at Northwell to communicate effectively. So the tool that we use here is TeamSTEPPS. Team strategies and tools to enhance performance and patient safety. It's an evidence-based framework to optimize team performance across the health system. The first tool that we are going to discuss is CUS. So if you are concerned about a situation and if you would like to stop the line, I am going to use the tool CUS. I am going to say, I am concerned, I am uncomfortable, and this is the patient safety issue, and I'm going to stop the line. For example, if you are assisting a person with a procedure and you did not see this person washing their hands and you are concerned about the safety, you can use CUS to communicate with this person. And also this can be a reminder. You can just tell your colleague that, I think you forgot to wash your hands, and you can remind them in regards to washing their hands. The next tool that we are going to discuss is two challenge rule. When your initial assertion is being ignored and you have to get your point through, we have to challenge it second time. And if the outcome is not acceptable and your message is not received, you have to escalate and follow chain of command. The next tool is brief. I'm sure you would have heard about this brief in your units. So it is just a short session. As it says brief, it should be a shorter session starting of the shift and going over and assigning roles and responsibilities so that we can anticipate what is the outcome. The next tool that we are going to discuss is the huddle, and it's almost like a brief, but the huddle is going to happen in the middle of the shift, and if you have an issue, if you have an issue or situation, we are going to huddle and discuss the situation to the team member and come up with a strategy how we can work it out. When it comes to debrief, it's almost after the situation. We are going to group together and discuss the situation, what went well and what can we improve next time when in the same scenario happens. So that's a debrief. For example, code situation. If you have a code and end of the code, usually the team gathers together and they do debrief to check on each other and also discuss about what went well and what can we improve on, so that they can prevent anything that can happen in future. So if you see this picture, let's discuss about this and think about it. We might be in a meeting and everyone is busy, but like if you see the picture, one person is thinking, I was supposed to leave this workplace an hour ago. What am I doing here, right? That's what is running in his mind. And in the meantime, someone else is thinking, did I punch in? I just came in, did I punch in? Maybe they are physically present, but you have to make sure that when you communicate or if you are involved in a situation, you're being mindful about your present physically and mentally. Let's think about all the barriers, communication barriers that can happen at workplace, right? For example, I'm working and I'm really tired. Am I in a good state to communicate with each other, with the team, or am I receiving the message from the team if they are communicating with me? That's a barrier. So fatigue, right? Workload, if I have increased workload, that can affect the communication. If I am distracted while I'm working, that might be a barrier for communication also. And also think about the communication style, like how we communicate. Also, conflict between the co-workers might be a barrier for communication. So how do we know our message is being conveyed or received correctly? So making sure that we close the loop of communication, that's very important, and also making sure that checking back. In case if I am giving report to a nurse, making sure that I give an opportunity for the other nurse to check back with me so that I am sure that my message is being interpreted correctly. And also if I am doing education for my patient, it is best to use teach back method so that the patient can teach back to me, and making sure that the patient has understood the procedure or the education correctly. Another tool that we have to keep in mind is SBAR. The SBAR is mostly used during RRT. If I'm the primary RN, I have to give a quick report on my patient to this team, I'll be using SBAR. Or if I'm calling the provider, if I am looking for something, I will be using this SBAR to communicate with the provider. So what is SBAR? As a situation, it is a punchline. We are going to use like 5 to 10 seconds, just quickly go over what is the situation. B is the background. I am going to discuss about, for example, if I'm in the middle of rapid response, I'm going to quickly go over the history of the patient, present diagnosis, so that the team is aware what is the background. Even the medication, allergies can be included in the background. And when it comes to assessment, we have to make sure that we focus on our assessment piece on the patient, like, it might be subjective or objective. We have to include all that so that the team will be aware, okay, these are the present symptoms, signs and symptoms that the patient has. And also recommendation, R is for recommendation, which is very important. We always recommend and encourage our nurses to recommend what are your thoughts on, like, what have to be done. TeamSTEPPS is a language we all understand. So we want to make sure that we utilize all these tools to communicate effectively. Culture. Let's discuss about culture and how important it is for us when we are with the patient and family members to keep in mind to accommodate their needs. This is very important. So what is culture? Culture is customs, values, attitudes, one's beliefs that is being handed down from generation to generation. So few examples of cultural practices such as dietary preferences. You might have kosher diet, vegetarian, non-vegetarian. You might have some birth rituals or beliefs, death and dying beliefs. So we have to make sure that we try to accommodate our patient and family members' needs during these situations. Please take a moment to visit our intranet page, which has the culture vision so that you can learn more. In regards to patient with limited English proficiency, it's very important for us to use the special phones that are available for you to use at the site. Please make sure that you refer to the policy and protocol at the site. It is very easy to use, and also it takes only 30 seconds for reaching out for the interpreter, and you will be able to communicate with your patient effectively. Let's take a look at this video, which involves family interpreters.
Good morning. How are you today?
Hi, doctor. I'm sorry. My aunt, she doesn't speak English. She only speaks Spanish.
Okay, so you'll have to translate for her today.
Okay.
¿Qué?
Tía, yo le voy a traducir por usted a la doctora. Todo está bien.
When was her last menstrual period?
Tía, ¿cuándo fue la última vez que tuvo la menstruación?
Ay, hace muchos años, muchos.
A couple of years.
Is she experiencing any vaginal discharge?
Tía, ¿usted tiene problemas yendo al baño?
No.
No.
She have any odor?
¿Algo le huele mal ahora mismo a usted?
Ahora no, nada.
No, nothing.
Okay. Is she, could she possibly be pregnant?
No. Pregnant? No, her husband passed away a couple of years ago. No, she can't.
Okay, and is she sexually active?
Tía, ¿usted tiene novio?
Ay, novio no se hace. No.
No, she's not at all.
Okay, I'll be back when some blood work comes back. Okay?
Okay. Ella va a regresar cuando regresen los exámenes de la sangre. Okay.
So what are your thoughts on this video? So make sure that you don't use your family members as interpreters, because we are not sure that how the message is being conveyed. We want to be very mindful about using certified interpreters which are available for us at the site. Please make sure that you refer to your policy at the site, or you can always reach out to the managers who will be able to help you. Patient who has hearing impairment or disability, we have to be very mindful about using live interpreters, and also there are signs available at your site. So make sure that you utilize to communicate effectively with these patients. If you see this visual, it projects the health literacy of America's adults. It is important for us to ask for the education level of the patient so that we can communicate with them in their level of proficiency. Let's quickly watch this video in regards to health literacy.
Hi, I'm Cassie,
And I'm Blair.
and today we're on the streets of New York interviewing people about their health literacy. Can you describe to me what hypertension is?
I'm guessing it's when you're really hypertense. I have no idea.
No, but it sounds bad.
I don't know that.
Hypertension would be overactiveness in the muscles.
So is it when you stress a muscle or something like that?
No, actually in the mind, maybe. Hypertension.
Hypertension is like a mental disorder.
I don't have it though.
To be treated with the proper medicine.
Hypertension would be overactive stressfulness.
I don't know what medicine it is. Maybe Haldol, Prozac, Prolixin, something like that.
Do you know what angina is?
Angina. I don't know, but it sounds pretty cool. No, I don't know. I haven't done it a clue what angina is. What is it?
Sounds like something familiar, but I don't know.
Do you know what a stethoscope does?
Is it the same thing as a microscope, or is it a totally different thing?
Nope. No.
What's the first word that comes to mind when you think of your relationship with your doctor?
I lied.
Difficult. Brief. Sometimes they don't listen to what you're saying, or that they go so quick that you don't understand what they're saying.
The doctors don't spend enough time with the patients that come in.
He never spends enough time listening to what I have to say.
Doctors do not communicate with me enough. Because I ask him every time, what's the matter with me? He said, Jason, you're crazy. I went to my doctor. I said, no one takes me serious. And he said, next.
They listen to your input in the beginning to figure out what the problem is, but after that, I don't think they care about what you think.
I'd like to see it more honest, open communication.
I don't think they always explain it to the patient in the same way that the patient would understand. Pro-doctor, but everybody is not at the same level, and sometimes I think they need to explain a little simpler.
They went to college, they went through so much school, and they do not communicate. Obviously not.
So after watching this video, you will be aware that their vision in regards to basic blood pressure. So, and also they were mentioning we want the healthcare providers to communicate more so that they can understand their condition. So this is very important as healthcare professionals. We want to make sure that we communicate well with our patients so that they know what's going on with their body. We have the opportunity to create an environment that we all want to work in and also provide the best patient care experience. Do your part to make it happen. We are made for this.